Welcome to the Integrated Health Psychology Training Program's Quick Studies in Health Psychology. This series will help you gain some clinical tools to become more effective at how you manage health psychology issues with your patients. In this particular topic, we'll focus at acceptance and commitment therapy and some change-focused tools to help patients become more effective at managing their hypertension, living the best life possible, reducing the risk of disease, and connecting to how they can be more effective at change in their own life. So to start off first, I want to give just a little bit of, so why are we talking about this? About 45% of Americans have hypertension, and only 10% of those folks have a disease that if you treat it with a medicine, it'll get better by itself. What we have is about 90% of Americans have hypertension due to a combination of genetics, lifestyle, stress, trauma, overwhelm, all things that we as health psychologists can be very helpful with. And in that group of people, that 90%, if they take antihypertensive medicines and make lifestyle changes, they will live longer, have a better health span, which means a longer time you'll be healthy, and reduce the risk of some pretty tough illnesses that can lead to disease, disability, and death. Cardiac events are increased risk by hypertension, strokes, and multiple other forms of health risk. But I'd like to just start off by saying that what hypertension is and what it isn't. Hypertension is in fact more like the smoke than it is the fire. If you see the smoke, you know there's a problem. Hypertension happens when there's something off in the biology, the psychology, or the social system that's helping sustain a human being. And the health psychologist's main job is to not get lost in the smoke, but to start to look at what's driving that fire. What are the things that are making hypertension more possible? And often these are things that we have some great tools at helping. Things like stress, managing your diet, changing how much you're exercising, connecting to people in a deeper and more effective manner. And these are things that psychologists, more than almost anybody member of the team, can support a patient to go through the grief process, to build some acceptance, and to connect in the meaning and purpose that will help them do this work. Yeah. So this is definitely the $10,000 question. How do you help a patient understand hypertension and feel empowered to change? So if we have patients who've experienced a lifetime of bigotry and stress within a medical system, they may actually not trust what's being said to them, not feel like they're empowered to create change, and our ability to be a bridge for that relationship, help them understand what's going on and connect with a meaningful reason to make some of the behavior changes can have a strong impact in their lives. And from just a general health change model, if people don't understand what's happening and why changing it may help, they're most likely not going to be motivated to change. So the big things are you want to have somebody really understand at a deep level what is hypertension, how it works, how it relates to their health, and then help them connect up to something in their life that motivates them to do the big changes needed to change hypertension. Because when you're talking about food, when you're talking about diet, and when you're talking about exercise, you're in essence getting to the core of what it means to be a person. You're engaging with the family structures. You're engaging with culture. You're engaging with personal history. And so working with hypertension is fundamentally understanding who somebody is, what drives them, and what motivates them for change. But one of the big things that I think we can help with is getting some metaphors that are relatable so that people understand how hypertension works. And so when I'm helping my patient understand how hypertension works, I'm also choosing metaphors that hopefully are empowering and help them understand their relationship with the process of change. So I'm going to give you two that I use regularly with people with hypertension. The first is the metaphor of the pump and the hoses. The heart is like the pump and our arteries are like the hoses. The harder the heart pumps and the less flexible and resilient the hoses are, the more likely those hoses are to break. That can cause brain injury, cardiac arrest. And also it works just like if you were to put your gas pedal on the engine and just rev your engine too high, you can just burn out the system. And so if we can help your heart pump less hard with less force and help those veins be more, those arteries be more resilient in the process of how they receive that, what you start to do is have less pressure on the system, less risk of cardiac events, less risk of stroke, and better longevity. So we have this core metaphor of how hard the heart is pumping and how tight the veins are. So there are two ways that there are the arteries. It is not veins, it's arteries. How tight the arteries are. There's two ways that the arteries can become tight. One of them is if you think about like an artery getting clogged, it's like if you ever put your thumb over a hose, it just sprays out with a lot more force. Inside the arteries, we can get plaques in there that just make it more pressure for the heart to get the blood through. And when the heart can't get blood through, the cells in the body can't get nutrients. And if they can't get nutrients, they're going to be working a lot harder to do their job. But also those pipes are at risk for breaking. The other thing that can happen is, unlike hoses, but also a little like hoses, our arteries have a little bit of give in them, and they can relax and close, and are both chemicals from our heart related to our stress response and in our brain. They tell those arteries whether they can relax or close and help it become more responsive. And in people with hypertension, those arteries themselves become a little less resilient and a little less able to change with the demands on the system. So if I'm running harder, they should be more open. If I'm sitting still, they should be more closed. If I'm getting up, more closed. Sitting down, more open. And that resilience within the system starts to go away. But the good news is that resilience in these systems can be built back in. And there's lots of things that people can do that. If someone loses 2.2 pounds of weight, they dramatically change their hypertension. If someone walks 30 minutes 5 times a week, dramatically change their hypertension. If someone addresses their depression or their traumas, they can dramatically change their hypertension. And so that's one of the metaphors. The next metaphor that I want people to get is what is actually happening in your hypertension number so they can know why measuring it matters. So that top number, that big number, this one here, the 120, is basically measuring how hard your heart squeezes when it's pumping. And the second number is how much pressure there is on the system when it's not pumping. And at normal, you get about 120, and at normal, you get about 80 at relaxed. If you have too much at relaxed, it's going to be the system is always under pressure. And if you have too much pumping at normal, you run the risk of kind of damaging those arteries as your heart pumps. Then you can get up into the next level up is prehypertension, which is 120 to 139, over 80 to 90. And in that zone, you want to start really be working on some behavioral changes to help reduce stress, increase social support, change sleep, improve diet, reduce salt. These things can make a meaningful difference so the person doesn't tip over into some of those more high-end hypertensive states. Now, of course, you have on the upper end 180 over 110, which is called a hypertensive crisis. And oftentimes, people will need some pretty solid medical interventions at that level. Although, if you're under enough strain or stress psychologically, you can get into that kind of state even without the need for change in medicines, which I've seen many times. One of the wonderful things here is that if you get someone to get one of those blood pressure machines that can measure at home, it can help them become empowered with their hypertension. And they can see if they practice a breathing technique like square breathing, or put something in perspective, or challenge some negative thoughts, before and after, you can start to see changes in your blood pressure from doing these events. And that's where the rubber really meets the road, is that if you can see that if you can lower your blood pressure by doing an activity, you can start to help a patient see that they can have an impact on their hypertension. And then if they know they can have an impact, then helping them connect to that why, the big why that motivates them, can be one of the things that you can do to help them move forward. So let's talk for just a moment about some of the ways that we can help hypertension get better with our interventions. Oh yeah, absolutely. People can change their hypertension. Yes, it is biological, but as any biological system is affected by psychology, it's affected by social support, it's affected by our environment of stress and trauma, it's affected by exposure to things like racism and adverse childhood experiences and lack of love and support and being in a food desert. And these are all things that maybe we can't go and put a grocery store in someone's neighborhood, but we can help people get access to high quality food within their environments. And please talk to one of your teammates. They will have many tools to do this. So here are some of the things that can really help your patients with hypertension. We know that if you change these things, you can dramatically change hypertension overall. If you check your blood pressure regularly, just simply being more aware makes better actions overall. Change your body weight. Set a goal of losing 1 pound every couple weeks or every week or every month, and start to do some activities that would do that. Do 30 minutes of exercise every 5 times a week. Manage your stress, treat your depression, manage anxiety, address trauma, increase social support, empower someone to live their values-based action, and to eat more healthily, avoiding salt and other kinds of stressors. And one of the other things I think it's really important that we talk about is that helping someone connect up to their values and why they want to change is one of the best ways to get somebody to change. Viktor Frankl would say that if somebody has a why, they can survive almost any what. And basically, when you're asking for hypertension change, you're asking them to dramatically endure some deep discomfort in their changes in their behavior. And they have to have a reason why to do that. Another thing that often blocks patients is the need to grieve that that number means something to them, that it reflects some of their choices, that it reflects some of the impacts that their traumas have had on their life. And having somebody to be in relationship with around that grief is the most important thing that you can do for somebody. And then once you've worked through the grief, building that deep acceptance of the fact that this is here, it's real, but it's changeable. Only if we start to deal with life on life's terms. So grieve the emotions, experience them, bear witness them to them with another person, and then do that deep work of accepting the fact of reality and making concrete, structured, and meaningful changes. And the good news is you can have a great impact on your patients as you do this. You know what? That's a really powerful statement. Change is always psychological, and real change is always rooted in relationship. You know, we have a tendency to think that hypertension is about changing a number on the page, but really it's about changing your relationship with yourself, your relationship with your family, your thoughts about life, your core beliefs, changing how you feel about your health, what it's like for you to have gone through the process of having a diagnosis and finding out that this matters, how it plays in to your sense of connection with others. And oftentimes real change requires feeling supported and cared for by people in our lives. And that's maybe some of the best stuff that we can do, which is help people reflect psychologically on how this impacts them and how change impacts them. But also to be that profound place of growth and relationship where people can explore and work with and understand themselves in a new way. And so when you're really working with hypertension, you're not just working with a number on a page, you're working with psychology, you're working with relationship. And frankly, you're also working with the culture and the society that we're in as well. And being able to realize that is really important. Yeah. So here's how I kind of go through working with a patient with hypertension. The first thing is you've got to build connection. And if you don't build connection, you really don't have much to work from. Like we were saying, relationship has such a powerful root in being able to change things. So the big three things that you want to do when you're starting off working with somebody with hypertension is build connection, build a sense of meaning, and build motivation for change. And this can help people do things like start tracking the blood pressure medicines or tracking their blood pressure or taking their blood pressure medicines. Relationship becomes the anchor that helps somebody invest. If a patient believes their medical provider and cares about their provider and believes their provider has their best interests at heart, they are so much more likely to even pick up a medicine, let alone take it. So be that kind of bridge for a relationship. And along with those things, and also maybe after or secondarily, depending on how it plays in our therapeutic interaction, I'm going to be assessing for lifestyle factors that impact somebody's hypertension. Things like sleep, diet, exercise, stress level, and change in salt, eating greens, those kinds of things. And I'm going to be particularly looking for three big things. What are they willing to change? What are they able to change? And what are they ready to change? And I can help people get more willing, able, and ready. But I also might want to find some things early on that they can build from success on. So if you find things that are both important and someone's willing, able, and ready to change, and they do that, they can then check that off the list and it feels empowering. And simultaneously to that, I'm assessing for some of the mental health factors that impact hypertension. Things like depression, adverse childhood experiences, trauma, grief, cultural factors that impact diet, and someone's relationship with medicine and the medical community. So if you have somebody who is given a DASH diet, but doesn't come from the American Western paradigm for eating, the DASH diet doesn't make any sense. And what we can do is we can walk with the principles of the DASH diet in with somebody into their experience of their cultural self and help them within their culture apply those principles in a way that feel responsive and respectful to them as a whole person, rather than trying to paste over somebody a series of prescriptions that don't work for them. Another one of the big things that I think that we just need to focus on is, and actually, honestly, I'm going to be straightforward. This is probably one of the most important things. It's the how you approach somebody as you're engaging in these important change topics. So motivational interviewing offers this empowerment-based way to engage with patients. And one of the ways it does that is through what's called the ask, offer, ask model. So first you ask permission to share, and then you offer some thoughts, an intervention or an idea, and then you ask how it impacted. So you're not going to share with somebody about salt and hypertension without initially asking. So this might look like, would it be okay if I share with you about one of the ways that changing your salt intake could improve your health and might really matter to you? And if they say no, we just move on. But if they say yes, that's when I can come in and I say, well, here's what I was thinking. Even minor changes in your salt intake can really improve your longevity, reduce your risk for health impacts. And I know you've said that being a parent is maybe the most important value that you're living with right now. And so as you do this, you're not only teaching your kids how to eat with a bit less salt so that they lead a better life, but you're also helping you be around for them. And I've seen people, when they first start to change the salt in their diet, food just tastes really bland. But actually over time, people's taste buds change. You know how like maybe when you first tasted coffee, it tasted pretty bitter and not very good at all. But over time, you started to like it. And so I'll encourage you to make sure that you use some kind of ground like that, that puts the patient at the center of their own experience and trusts them to be the agent of their own change. Another core thing when I'm working with changing hypertension is helping somebody do some of those deep values-based exploration, building the why for change. As Viktor Frankl said, and I've said a few times, if a person has a why, they can survive any what. And the real change in behavior is difficult, it's uncomfortable. A lot of times it feels hard, and it's hard to see the outcome. With hypertension, you don't even feel sick half of the time. And so it might even be hard to see why you're doing this. So connecting it up to a value can be very powerful. So I may ask somebody to look at a list like this compass map and just say, which ones of these matter the most? And then have them share with me why that value matters. And then share how they connect hypertension care, how they connect up their change to that value. The same way that I was talking about parenting, they may want to talk about their spirituality and say, in my spirituality, God says that my body is a temple. And because of that, I want to treat it like a temple. And that really matters to me. And you can help them from that meaning shift into big behavior change. And the last big part of hypertension care, from my point of view, is making goals that people can reach. There's nothing worse than setting a goal and then feeling like a failure. So set SMART goals that are behaviorally anchored and accomplishable. And SMART goals work like this. They're specific, they're measurable, they're attainable, they're relevant, they're important to the person, and they're time bound. And if you do that, you can actually have goals that really impact. So a non-specific goal was, I'm going to eat better. Very specific goal might be, I'm going to eat 3 salads this week and reduce my salt by 50% in every single meal. And I'm going to keep track of the negative thoughts and practice challenging those negative thoughts. Every time that the food tastes bland, I'm going to challenge some of the negative thoughts. So in summary, if you build your connection, a sense of meaning and motivation, it launches the relationship in a way that makes sustained change more possible. You want to assess for lifestyle changes and mental health factors that could impact hypertension. And while you're doing that, look for ones that people are ready, willing, and able to change, and ways to enhance somebody's readiness, willingness, and ability to change. You want to empower the patient using the ask, offer, ask model for motivational interviewing. You want to help somebody connect to their why through values clarification, and set SMART goals that are specific, measurable, attainable, relevant, and time bound.